Hello, good evening guys. So hope you are studying well for your preparation of the tomorrow's examination, and today's in the live streaming. So we are going to be discuss related to the what are the important topics. Okay, so it's like the rapid revision for your tomorrow's examination, and the most important aspects are the concept which will appear in your examination. Okay, so we will going to be discuss related to that one, and including that one. So we are going to have the some of the predicted 10 marks, 5 marks and the short answers. Okay, so by the end of this discussion of the concept session, so we are going to be release, or we are going to be show the whatever the expected 10 marks and the 5 marks questions are there with you peoples. Okay, so by not doing the delay, so today we will going to be start with the rapid revision, or it's like a fast track classes, okay, for the 4th semester, that is adult health nursing 2. Okay, okay, so the initially adult health nursing is going to be called it as a medical surgical nursing, but has a semester scheme, so we are going to call it as a adult health nursing 2 for the 4th semester. Okay, so in the adult health nursing, so we are going to be having the mainly the 12 units for your examination. Okay, for your the semester wise, so we are going to having the 12 units. In that one 12 units, so we are going to be preparing very well for the tomorrow's examination. Okay, so then we will start with the first unit. Okay, the first unit that is the nursing management of the patient with the ENT. The ENT, okay, and this is the one of the 10-star unit. Okay, so this is one of the 10-star unit which is very important for your examination. Okay, has the point of view of the university examination, the from the past 2 semester. Okay, from the past 2 the annual examination, the semester and the supplementary examination, the both 10 marks questions are going to be appear from the this one. Okay, so even we have predicted some of the 10 marks question also, and this is the very important topic for your examination. Okay, so the ENT, so in the here we are going to be discuss the, or we are going to be see the topics related to the ear, nose and the throat. Okay, so the disorder related to the ear, the nose and the throat. Okay, so in the ear especially, so we are going to having the mainly 3 types of the disorder we are going to see, that is related to the outer ear, the middle ear and the inner ear. Okay, the inner ear. So as it is a very important for your examination, for it the question going to be came from sorry, it is 15 marks. Okay, for your semester the long essay will be for the 15 marks, right? Okay, so for the every sector, okay, from the every section it will be 15, the 5 mark, the 2 mark and the MCQ. Okay, so from this unit we are going to be expecting the question in the all section. Okay, in the 15 mark section, 5 mark section and 2 mark section and the MCQs. Okay, so that's the reason we will see some detail related to this unit. So in the outer ear we are going to be having the like the ear wax will be there. Okay, so some of the condition we are going to see, and very important here the middle ear and the inner ear. Okay, so in the middle ear we are going to having the 2, that is otitis media, okay, the and chronic CSOM. Okay, so acute otitis media we are going to be having, and the chronic otitis media are the chronic suppurative otitis media. Okay, so these 2 will be the very high yield topic. Okay, so the 10 marks for the tomorrow examination, the 10 marks question may came from the these 2 condition. Okay, once again we will have the list of the 10 marks, 5 marks in the end also. So here also I am going to highlighting that these 2 topics will be very high yielding topics for your 10 marks exam. Okay, for the 15 marks, for the 15 marks for your examination. Okay, then the next related to the inner ear, here we are going to have the again the 2 important, that is the labyrinthitis and the Meniere's disease. Okay, the labyrinthitis and the Meniere's disease. So that is also very high yielding topic which may expect to come as a long essays in the tomorrow's examination. Okay, so that is related to ear, and the nose and throat we are going to be learned togetherly. In the nose, so we are going to have the infection of the upper respiratory tract. Okay, sorry. So the infections of the upper respiratory tract like rhinitis will be there, sinusitis will be there, okay, the pharyngitis will be there, laryngitis will be there. Like that, the infection condition we are going to be see with the nose, and the already in the last year related to the nose and the throat, the tonsillitis, okay. So it is also one of the very important the topic which already has been asked in the last year examination. So we are going to be expecting from here the 15 marks and the 5 marks, 2 marks and the MCQ for your examination. So this is about the first unit, that is ENT, okay. So don't here forget to study about related to acute otitis media, chronic suppurative otitis media, labyrinthitis, Meniere's disease and the laryngitis and tonsillitis, okay. So these are the high yielding topics from this unit which you are going to be expecting in the tomorrow's examination, okay. So this is about the first unit, that is the nursing management of the patient with the E and T, okay. So we'll move on to the second unit. So in the second unit, so we are going to be see the disorder related to the eye, okay. As you already know, the whole semester you are studying. So the second unit, that is the nursing management of the patient with the eye, okay. So here from this unit also we are going to be expecting as the short essays, the short answer questions we are going to be expecting from this unit, okay. So in this unit, so we are going to having some of the important the topics like the retinal detachment will be there, the cataract will be there, glaucoma will be there, okay. So that 3 is the very major the condition we are going to be having, that is the retinal detachment, the glaucoma, and for this, so we are going to be suspecting that, so the one of the important, that is blindness and the eye banking, okay. So this is one of the important the topic has compared to the year wise, okay. So has the previous year, so when it was the medical surgical, so this is also one of the high yield topic or the high content topic from the this unit, okay. So apart from this one, so here we are going to see the related to the the functions, the anatomy and the physiology of the eye, okay. So for the short essay, for the short answers, they are going to ask about what is the functions of the pupil and what are the layers or what are the fluids are going to be presented in the eye, okay. So mainly we are going to having the 2 types of the fluid, so like that they are going to be asking, and here we can going to be expect for the even MCQs also, okay. So MCQs also we are going to be expecting from this unit. So in this unit, these 3 are the very important, with including the blindness and the eye banking, So whatever you are going to be study in this unit, so these are the major topics you need to be cover for your tomorrow's examination, okay. So next we will move on to the next unit, that is the third unit. So the third unit we are going to be having the nursing management of the patient with related to the kidney, okay, and the so we are going to be having the kidney and the urinary system, okay. So from this unit, okay, so here for the kidney and the urinary system we are going to having the, again it is also one of the very important for the short essays will be there, okay. The long essay may come from this unit or may not, but also this is a very important for the short essays, the short answer and the MCQs, okay. So in this unit, so mainly you need to study about the NS, okay. The NS is nothing but not a normal saline, okay. So the nephrotic syndrome, the nephrotic syndrome is one of the very important condition of this unit. And apart from this one, so we are going to having the some of the infective condition whichever very important for your short essays, okay. The infective condition like the cystitis will be there, okay, nephritis will be there, the polynephritis will be there, okay, ureteritis will be there, means there is an infection and inflammation of the different parts of the kidneys, okay. The kidneys, kidney glomerular nephritis, it is the infection and inflammation of the kidneys. Ureteritis means the infection and inflammation of the ureter. So like that, so there will be some of the important the infection we are going to see, especially for the short answers, okay. For the short answer, these infections are the very important, okay. So apart from this one, so we are going to having here the very again important, that is renal calculi and the renal failure, okay. So these two also very important, okay. So mark it as a very important for your tomorrow's short essay, okay. For the short essay, these two will be the very important for the examination, okay. So the renal calculi, or we can call it as the renal stones, okay. The renal stones or the renal calculi, in that one the different types of the renal calculi are there, okay. So what is the management of the renal calculi and what are the surgical intervention we are going to be used with the renal calculi, the patient with the renal calculi. And here the pain reduction, okay. The pain reduction is one of the very important the nursing diagnosis we are going to be see with the renal calculi. And in the case of, and apart from that one, the renal failure, okay. So already we have studied related to this one, we are going to having the two types, okay, the acute and the chronic, okay. So the acute renal failure and the chronic renal failure, okay. So and don't confuse with that one, for the renal failure, okay. So it is also called as a kidney injury, okay. For the purpose of to make you confusion, the examiner will ask, okay, so explain about the acute kidney injury, okay, or the chronic kidney injury, okay. So that is also same, and the renal failure, acute renal failure or the chronic renal failure, okay. So that is also the both the meaning they are going to be similar, okay. So renal calculi, renal failure, the nephrotic syndrome, glomerulonephritis, the infective conditions, and including this one, so we are going to having the one of the important topic, that is BPH, okay. So that is benign prostatic hypertrophy. So this is also again one of the high yield topic for the examination, and which may expecting to have in the short essays, okay. In the short essays we are going to be having the this question, okay. So these are the important topics which will be related to the kidney and the urinary system, okay. So next we will move on to the next unit. So the next unit we are going to be having the unit number 4, the male reproductive system. So in this male reproductive system, so again it is the important, but we are not going to be expecting for the long essay and the short essay. So here we can expect the question has a short answer and the MCQ, okay. So here we are going to having the only minor 2 to 3 important condition, although it is a very important for your MCQ, okay. So you know that the MCQ, from which corner of the textbook or the which corner of the syllabus the MCQ they are going to be arising, okay. To solve the MCQs, so we need to be know thorough about the every unit. We are not going to consider it as a minor unit or the major unit. So we need to be study the every unit, okay. And so here we can expect from this unit, so we can expect the short answers, okay. So here we are going to having the some of the congenital condition, okay. The some of the congenital condition like phimosis and the paraphimosis, okay. So some of the condition like phimosis and the paraphimosis. So just definition, okay, for the 2 marks. So it is a abnormality of the foreskin, okay. So as you already know, the phimosis, so where there is a retraction is going to be not possible, okay. At the time of the penile erection, the retraction is not going to be possible. So that condition we are going to call it as the phimosis. The paraphimosis, so once the retraction of the foreskin has happened, it is not comes to its original stage, okay. So the phimosis is a condition where, so it is a condition of the foreskin where the foreskin is not going to be retracted from the glans penis. Okay, so that is the definition, and you need to be you may write about one of the two signs and the symptom related to that one. Okay, so these two will be the very important with the this male reproductive system. Apart from this one, the sexual dysfunction. Okay, so the sexual dysfunction is also one of the important, so where we are going to see the premature ejaculation and the erectile dysfunction. Okay, so in the sexual dysfunction, so we are going to having the two condition, the short condition, the small condition, so that is the premature ejaculation and the erectile dysfunction. Okay, so this is also very important for your 2 marks. And the next, apart from this one of the important, so that is infertility. Okay, so at the present society, the infertility is nowadays becoming the very big problem. Okay, so whenever the examiner is going to test your knowledge and he is going to be asked the whatever the current trends are going to be running in the society, so for of that one, so this infertility that may ask going to be in your tomorrow's examination, and this is again one of the important topic. Okay, so this is also one of the important topic with related to the male reproductive system. So apart from this one, so we are going to having the one of the condition like gynecomastia. Okay, so this is also one of the important topic for the 2 marks. Okay, so the gynecomastia, that is the enlargement of the breast in the males. Okay, so that you already know related to that one. Okay, so this is also one of the important. So the male reproductive system, so that is a, as I told, it is a small topic and having the some of the minor topics which will be important for your short answers and for your MCQs. Okay, don't forget to be study this one. Why? Because the MCQ may occur from this one. If you did not study, you are going to be lose the marks and all. Okay, so this is the related to the male reproductive system. So next we'll move on to the next unit. Okay, the patient. Okay, the nursing management of the patient with the burns and the cosmetic surgery. Okay, so this is again one of the very important 10-star topic. Okay, so from this unit also has up to your semester wise, so we did not came across. Why? Because the semester has been adopted only 1 year back. So the means that fourth semester, the first batch has been output only 1 year back. So that's the reason here from this unit, so we are going to be having the 5 short essays we are going to having, but as compared to older syllabus for the older year wise, so this is one of the important topic for the long essay. Okay, so for the past 1 year, so they are going to be asked the short essays from this unit, but before to that one, so this is one of the very important topic for the long essay. Okay, so don't forget to be study with this one. Here the especially the assessment of the burns. Okay, the assessment of the percentage of the burns by rule 9. Okay, so you already studied in detail related to the this rule 9, and again it is also one of the important for your the short essay question also, and just they are going to be tell about the rule 9 in the short answer also. Okay, so this is the assessment of the burns by the rule 9, and so the role of the nurse. Okay, the role of a nurse in the fluid management. Okay, so this is also one of the very important, that is the fluid management or the fluid calculation by Parkland formula. Okay, so from here the burn assessment by the rule 9. Okay, so apart from that one, the fluid management, in the fluid management, so either there may going to be asked, okay, so if there is a patient, the name of the patient with the X, he is going to come with the burn of 25% of the burn, and he is having the 60 kg weight, and calculate the fluid management or calculate the fluid required for the management in the 24 hours or the 48 hours, like that they are going to be asked what are the fluid required for the this individual. Okay, why? Because in the burn patient, the fluid is the losses. Okay, the fluid loss is a major condition we are going to see. Okay, so that's the reason here. So we are going to be expecting the very important. So by using the Parkland formula. Okay, so I think you already know about the Parkland formula. So that is the 4 ml into the total body surface area burnt into body weight. Okay, into body weight. So this is the formula for the Parkland. Okay, to calculate the total amount of the fluid required in the 24 hours or the 48 hours. So here we are going to having the 4 ml and the total body surface area, so which has been burnt by the rule 9, and the body weight whichever has been given in the questions. Okay, so that is the total required for the fluid management. So apart from this one, so we are going to be having here the one of the so here we are going to having some of the cosmetic surgery. Okay, so in the cosmetic surgery, so we are going to having the skin grafting. Okay, so we are going to be, so whatever the burn has been occurred, okay, whatever the burn has been occurred, so in that one, for the areas, okay, for the areas wherever the burn has been occurred, we are going to having the some of the cosmetic surgeries. Okay, so there we are going to having the skin grafting surgeries. There will be a different types of the skin graftings are there, like allograft, heterograft, xenograft, so like that. So they are going to be asked for the short essays. Okay, so this grafting, the skin grafting is also one of the important topic for the short essays. Okay, so this is about the important topics with related to the burns and the cosmetic surgery. Okay, so next we will move on to the next unit. Cosmetic. Okay, next we will move on to the next unit. So the unit will be unit number 6, which is going to be the neurological disorders. The nursing management of the patient with the neurological disorder. Okay, so before going to this unit, so neurological disorder, the nursing management of the patient with the neurological disorder, this is also again one of the very important topic. So as I already told, for the semester scheme, okay, for the semester scheme, as we have only the 2 examination, so from that, so here we are going to having the short essays, but when it comes to again year based, okay, so in that year based, this is again one of the very important topic for the long essay. Okay, so from now also we may expect the long essay from this unit, or we are going to be expecting the question of the short essays and all. Okay, so in this neurological disorder, the mainly important topics we are going to having the assessment. Okay, the assessment of the neurological statuses. Okay, the assessment of the neurological status is also one of the important topic we are going to having. So apart from this one, so here we are going to having the some of the very important topics like the head injury. Okay, the head injury we are going to having, and CVA, that is cerebrovascular accident, or we are going to call it as a stroke. Okay, so or the paralyzed. Okay, the paralysis. So that is also one of the important topic we are going to be having here. So apart from that one, so here we are going to having so some of the infective condition like the meningitis or the encephalitis. So these 2 topics also very important for the short essays. So apart from this one, so we are going to having the disorders or the diseases with related to the spinal cord. Okay, so the spinal cord injury will be there, the spinal cord, the herniation will be there. Okay, so such type of the condition we are going to be see with the spinal cord. So that is also very important. And apart from this one, so in the CNS we are going to having some of the autoimmune disorders like the myasthenia gravis and the Guillain-Barré syndrome. So that is also one of the very important. So apart from this, so we are going to having the degenerative conditions. Okay, so the degenerative condition like Alzheimer's disease, the Parkinson disease. Okay, so that may ask for your the short essays or the short answer. Okay, so they are going to be asked about, so define about the Parkinson disease, or what are the 4 clinical features of the Parkinson disease, or the 4 clinical features of the Alzheimer's disease. Okay, so like that they are going to be asking. Otherwise, if they ask for the short essays, directly they are going to give explain in detail about the Alzheimer's diseases. Okay, so like that they are going to be asked. Okay, so from this unit, so up to for the semester wise, so they asked only for the short essays, but we are going to be expecting the questions also even from the long essay also. Okay, for the long essay also we are going to be expecting this one. So here the main important like the assessment of the central nervous system, okay, by the neurological examination and the GCS scale. Okay, so GCS scale is also again one of the important for your 5 mark or the short essay. Okay, Glasgow Coma scale. So assessment of the Glasgow Coma scale are the what are the parameters we are going to be used in the Glasgow Coma scale. Okay, that is also one of the very important. And apart from like head injury, okay, and stroke will be there, and autoimmune disease like the myasthenia gravis and the Guillain-Barré syndrome, the degenerative condition, and the condition related to the spinal cord like herniation will be there. Okay, the apart from the herniation, the spinal cord injuries. Okay, so that is also very important. Okay, so this is the important topics we are going to be having from the neurological disorder. Okay, so next we will move on to the next unit. So that is unit number 7. Okay, before going to be unit number 7, so in our today's live session we are going to be join with the ma'am.
Good evening everyone. So far sir was discussed till neurology, and the 7th unit we have immunology. In this particular we are going to study about HIV, AIDS and other eugenics diseases, and we hear how the role of nurse which will be there, and how the role of nurse which will be taken in the place of counseling. That is the unit we are going to study in this particular immunology.
Yes,
so it is also one of the vast unit, and you should know thoroughly about this unit to maintain a proper management of the sexually transmitted diseases like HIV and the AIDS.
Yes, as ma'am told, this is one of the very important. So as we are going to having the, as ma'am told, AIDS and the HIV is a very important, and the routes of the transmission. Okay, the treatment related to the HIV AIDS and the management of the these immunological disorders. So we are going to be expecting the short essays and the short answer from this unit. Okay, so here the mainly the transmission. Okay, the transmissions is also very important. Okay ma'am,
how the process of transmission which will be taken place. Okay, so especially the healthcare workers, healthcare providers are the vulnerable group members to get this diseases easily, because they are working in the front line, right? So you have to know the entire management of HIV and the AIDS and other sexually transmitted diseases also in this immunology.
And in this unit, so we are going to having again the one of the important topic, that is the NACO. Okay, so related to the National AIDS Control Organization. So that is also one of the important topic we are going to be having here. So how the prevention, okay, and how the counseling is going to be takes place by the government of India. So we are going to having the one of the program. Okay, so that is NACO. So this is also one of the very important for your examination for the short essays. Okay, so this is about the unit number 7.
So unit number 7, already sir told only 5 marks and 2 marks type of questions we are expecting. So the weightage you understand and study. Okay, while seeing the entire unit we come to understand where we have to focus more and where we have to be like neglect. Neglect means I'm not telling to neglect everything, because in sake of MCQs you have to study entire unit, but even though you know, right, where they can get the question for particular sector, you know, right? So according to that you can move. The next topic is oncology, the 8th unit. The 8th unit is oncology here.
So this is a very important topic when it comes to semester wise, ma'am.
Yeah.
Why? Because so from the past 2 exams has been done. Okay, one supplementary will be there, one annual examination. From this unit only, so we are going to be having the 15 marks questions. Okay,
Yes.
so that's the reason in the before of the semester scheme also, and now also the oncology is again very important for the examination. So if we are going to tell it is a 100 star also, it is not then a wrong thing. Why? Because so such type of the weightage is going to be present in the oncology.
Yes, sir.
And such type of the condition, the conditions we are going to be having in this oncology.
In current trends also, what we are doing, we have to
Yes.
focus more on the palliative care.
Yes,
I
ma'am.
have observed that currently the doctors also getting the training, the doctors and the nurses getting training. You can see wherever you will go, you will learn through this workshops and all assigned for the palliative care only, which is comes under this oncology only. We have to provide a proper care for the cancer patients. Okay, so the entire things you are going to be study in this particular unit.
Yes.
You can go.
In the oncology, as ma'am told, the palliative care is a very important for the patient who are with at the end of their life. Okay, ma'am. The palliative care will be there, hospice care will be there. Okay, so that is a very important. And apart from that one, so here we are going to having the some of the short essay very important, like the warning signs. Okay, so the warning signs of the cancer. So we are going to have the one of the mnemonic for that one has a caution. Caution.
Yeah.
So for the caution, we are going to be having the one of the very important for the warning signs. And apart from that one, here very important are the treatment modalities.
Chemotherapy.
Yes. What are the
radiation therapy.
Yes, ma'am.
Sorry, okay.
So in the treatment modalities, so we are going to having the different types of the treatment modalities will be there, like the chemotherapy will be there, the surgical therapy will be there. Okay, and the next bone marrow transplantation will be there, sclerotherapy will be there, immunotherapy will be there, hormonal replacement therapy will be there. So like that, the different types of the treatment modalities are there, which are very important for your upcoming or the tomorrow's examination. Okay, so in the warning signs are the very important, and the treatment modalities, and apart from this one, the particular cancers. Okay, the different cancers we are going to be having for our examination, like from whatever the different body parts.
For example, we are having a breast cancer. This is one of the cancer which we can see nowadays. Okay, so according to that breast cancer, we have to provide a very good care for them, and as well as we have to take a preventive measures to curb the breast cancer. Okay, so that and all the things you have to study for, not only for one particular system. Each and every cancer you have to focus on this particular unit. And the meanwhile, what you have to focus regarding already sir told, when come to the treatment modalities, chemotherapy will be there, radiation therapy will be there, and sir told surgery also will be there in that. For breast cancer we have to go through the mastectomy.
So as you taken the very nice example, ma'am, breast cancer. Why? Because already for the last exams they asked about the brain and the oral cancer. So this breast cancer is I thought that I will tell in the later, but ma'am only now told. So this is a very high yield which may 90% expecting for the tomorrow's examination. So as I already told before, whenever the examiner is going to be sit for to take the select the questions, he is going to think about the current trend, whatever the current trend is happening in the society. Okay, so as we know that the breast cancer is again one of the very
common emerging cancer in the younger generation nowadays.
So that's the reason that breast cancer we are going to be expecting for your tomorrow. So not only that one, apart from that, it will be a intestinal will be there. Okay, the liver, whatever the different body organs are there. Okay, so for every from a single cell, the cancer is going to be arises. Okay, so for our the different body cells, the different body parts are there. For every we are going to be having the expecting the questions from the tomorrow's examination. And don't forget to be study related to the hospice care and the palliative care. Okay, so that is two are also very important for the tomorrow's examination.
Yeah, see, sir already explained this one, right? Modalities, treatment modalities. You can write for according to sir content, we can write it down in a 1.5 page. Okay, that much content was there in a very minimalistic way. He has told, right? So same thing you have to implement in each and every cancer. Whatever they may ask, also you can write in a common way. Okay, so and this one warning signs, the caution you have to remember and you have to write it down. That is a eye-holding point for your answer. Okay, so this all the things you have to cover, and preventive measures don't forget to write. As a nurse you have to take care, you have to work in the healthcare sector, you have to provide education, right? You should know how to prevent this one. So that is the thing you have to enhance your answer in the question paper. And the next we can go with the 9th unit.
Yes. So the 9th unit, so we are going to having the emergency and the disaster, the management. Okay, so in this unit, so the emergency and the disaster management, so here we are going to be see related to some of the emergencycal conditions. Okay, so it will be like snake bite will be there, poisoning will be there, cardiac arrest will be there. Okay, so there will be a electrical or the thermal burns will be there. So even burn is also one of the emergency condition where we need to be have the treatment within the shorter time. Okay,
Dislocation.
Yes.
Today, yesterday class we have taken for first year,
second
semester batch.
Yes,
Okay, so there they asked first aid for dislocation. Okay, so same like that here we have certain emergency disease like conditions. So according to the modalities you have to go through the treatment.
yes, so that are the important for the emergencies. And here in the especially emergencies, so what is the first aid? Okay, so as ma'am told, the first aid treatment or the first aid management, so we are going to be having that is a very important, has a role of the nurse. Okay, if you are in that situation in the emergency time, so what is your role there? Okay, so that with with respect to the particular condition they are going to be asking. And with this one, so we are going to having the disaster management. Okay, so the disaster management is also one of the very important, and which we are going to be see in the public ways. Okay, so whatever the so whatever the condition, the disease condition we are going to be see, it will be with related to, apart from some of the emergency condition that will become at the hospital based. Okay, so but when it comes to disaster management, okay, but when it comes to disaster management, so this one we are going to see at the public. Okay, so if you are in the public, so if there is any disaster happens, like it will be any natural or the man-made, we know that. Okay, the types are there, so it will be any natural will
A
be there,
huge
man-made.
big accident,
Yes,
or
ma'am.
it may be a disaster. You can see that plane crash recently
that
we
is
have
a very,
seen,
very-
right? So
What
those
to tell that one only? Tell
Yeah,
me.
yeah.
Yes, ma'am.
so that kind of things we can easily remember, like for your sake of knowledge, as well as you remember in such a way you are taking example, definitely you will remember the answer also in such a quick way in the examination also. So at the time when it comes to this one department, emergency and disaster, see, we have to be very skillful.
Yes, yes.
And we have
The
to be
skills are very necessary
and
for
we
it.
have to be act in a very fast and furious. Okay, so that is the thing you have to utilize, okay, while writing the management also. So role of nurse also, you use the words like quick and curious type of action should be taken by the nurse. Okay,
Yes.
so these are the things you are not going to write like management only. We are focusing on more in this adult health nursing.
Yes, ma'am. The management, the nursing management is a very important, apart from the pharmacological and the surgical. As we are the nurses, the nursing management is a very important. And if I want to tell in the disaster management, so the especially the triage, okay, the triage system. So that is also very important in case of the both emergency and the disaster management. Okay, so the triage system will be there, and the disaster team. Okay, so one of the for every hospital or for every organization, so it is having the own its disaster team will be there. Okay, so what are the members will come under the disaster team will be there, and the triage system. Okay, that these two are the very important for your examination. Okay, so this is about the emergency and the disaster management. So from here again I told that the short essays and the MCQs. Okay, the short essay, short answer, and the MCQ we are going to be expecting from this unit. Okay,
And also focus on the types also. Okay, the types
yes,
of this
ma'am. Types of the disaster. So whatever it will be, either natural will be there like floods and the heavy rainfall will be
Tsunami
there.
and all will become no, so that kind of things which will be comes under the types, and man-made also sometimes. Okay, I told now that
Plane crash.
Yeah.
So actually it will, yes ma'am, that one will be. And apart from this, so if you want to see here, the has you are a nurse, the MLCs, okay, so the medical legal cases, okay, so has the role of the nurse. What is the role in the MLC if the any case has been come with a poison or the any accident? So the MLC case we need to be registered, and the protocols will be for the MLC. So that one also you just see, it will be okay.
Which will becomes under the ethics like legal and ethical principle of nursing, and that management will become okay. You have to take the like for further legal action we have to support through this MLC. Okay, medical legal cases should be recorded, and then for the further action will be taken place. So that is very important point, and so far we have discussed all the things in this particular unit, and you have to go through like 5 marks or 2 marks, maximum 2 marks, or they may ask for
the 5 marks somewhere like try system.
Yeah,
like
MCQ
and MCQ is a very this will
2 marks they will ask what they will ask types and all they may ask for this. Next we can go with the 10th unit, the care of elderly, one of the very important point of unit, and we can tell we have to educate the younger generation also, right? By this unit.
Actually this unit is, it is a care of elderly, okay, so this unit name is having care of elderly, but this unit is very specific, and that this unit need to be learned by younger generation. Okay, when the individual, so one or the another day we will also become as a older, okay, so at that time, so whatever the conditions they are going to be facing, okay, for that one, as we are the nurses, we need to be educated in this unit. The education and the psychological support is a very key concept for this one. Okay, so there are the different conditions we are going to be having, though some of the psychological problems will be there, okay, and abuses of the elder abuses will be there, okay. So that for such conditions, okay, as you are the nurse, okay, so what are the psychological support you are going to be giving, and what are the nursing role of the nurse when if the elderly will be suspected with the abuse, okay, the physical abuse will be there, the sexual abuse will be there, the emotional abuse will be there, okay, so the different types of the abuses we are going to be having. So for that one, has a role as a nurse, what is our role in that one? Okay,
see, in America recently I have seen, sir, so for caring elderly, the nurse are they will show any kind of anger issues or any kind of things they which will be abusing, or it is not good way. The peoples, the American nurses has been trained, they can't able to walk. You may also see in the Instagram and all, okay, so they can't able to walk, like that kind of clothing they used to give for the nurses. By the time the nurses can able to understand how the elderly people are has been suffering, okay, so now we are having age, energy will be there, we will act according to our energy, okay, but once we will go to that particular age, certain demands will be needed, okay, by the time. So for this emotionally the nurses has to be connected and have to be provide a care that matters a lot. So as a point of social consideration, I would like to tell this one. And when come to the unit, you have to focus more on the things which is comes to like psychological problems and abuses.
Problems, some of the psychological problems that will be suffered by the old ages, and the abuses will be whatever the abuse. I already told that, like physiological abuse will be there, emotional abuses. So that at
financially,
financially,
they see, they feel like alone sometimes, okay, if we people feels alone, it will be hit in a different perspective, right? The same like when it comes to, see, younger generation will not going to more focus on the older generation, and they are not going to be provide us emotional support, that will be always affecting on their psychological things, okay. So that is how they will think, I am alone, nobody will take care of me. This kind of discrimination or this kind of the things which will be there inside the elderly people, so that may affecting too bad. And when it comes to their having any kind of disease condition, the care is matters a lot, okay. So all the things you have to be covered. And while explaining, I think this from this particular unit we can express like expecting that 5 marks question, okay?
Yes. 5 marks we are going to be expecting from this unit, and even it will be for the short answers also, okay? So the MCQ, it will be there, but for as part of the MCQ, so we need to learn each and every unit, okay? So we are not going to miss the any the single concept in the whole syllabus, okay? So for that one, so the important wise, so psychological concept are the problems, okay, the abuses, and the some of the ethical and the legal issues, okay? The ethical and the legal issues will be very important with respect to the this unit. So this is about the 10th unit, okay? So next we will move on to the next unit, the unit number 11, that is the critical care, or the management of the nurses, the nurse with a critical care, okay, the nursing care. So here we are going to be study, or here we need to be focuses more on the related to the staffing pattern, okay? So as the exam wise, as a in the point of view of the examination, so here we are going to be see the staffing pattern of the ICUs will be there, and so the very important, the infection control, okay? So the infection control in the ICU settings, so that is also one of the very important major thing. And apart from that one, so here we need to learn in detail about the ventilation, okay? So that is the mechanical ventilation. So the mechanical ventilation we need to be learn more in this unit. And apart from this one, the ACLS guidelines, okay? So in this unit, so we are going to having the very important as a ACLS guideline, that is advanced cardiac life support, okay? So that ACLS guidelines is also very important, okay? So the staffing pattern of the ICU and infection control, how we need to be control the infections in the ICU, that is also very important. And the mechanical ventilation and the ACLS guidelines, okay? The ACLS guidelines is also very important. So when we are going to be learn this the critical care unit, so from here we are going to be expecting as the short essays, the short answers, and even for the MCQs also, okay? So this is related to the critical care.
Yeah, physical setup also is one of the concept you have to study in this particular unit. Here few peoples are asking about the post BSC biochemistry. Yeah, everything we are going to be conduct when your examination will come, by the time we used to do. Or else you do one thing, if you want immediately wants to know, you just go through our channel, you check it out in our video section, you will get the videos, okay? So there post basic BSc biochemistry and biophysics already explained, so go through the complete video, definitely you will get
GNM,
the important question meal wise.
GNM first year GNM they are asking much.
Yeah.
Okay, we will do the classes on the GNMs also, and PBBSC also. With the upcoming days GNM, the exams will be start from either I think 29, right ma'am?
Yeah.
So for that also the classes
definitely we are planning, we are working on through your examination sessions. Definitely we will going to provide a qualitative teaching things for your examination, which will definitely guide you best and prepare you in a very good way. And next we have occupational diseases. Yes, this is one of the very important and very you will remember for so long this unit, sir. Right now, sir?
Yes ma'am. So this is one of the again the small unit also. This is a very nice unit, as ma'am told. So why? Because after finishing our courses, okay, so we need to be start occupying, means we need to start working. So whenever at the time of the working sector, not only in the as we are the nurses, we are going to be working in the hospital setting. So not only at the as a hospital setting, so what are the different the occupational diseases we are going to be having in the different sector, okay? For example, in our profession, okay, as we are in our profession, we will be more prone for the infections and all, and especially as a nurses we are much more prone for the needle stick injury. So that is also one of the condition we are going to see, like that for every profession. So whoever will be prolonged sitting, okay, so that will be going to suffering with the some of the obesities and there, okay, so that will be who will be prolonged standing, like the road traffic polices are there, and they are going to be suffered with the DVTs, okay. So like that for every occupational, so there will be a the diseases will be there.
For
okay?
example, teachers, we used to get arthritis kind of disease conditions when it
And,
comes to our older age, not now.
Yes,
Yeah.
and including that one, the cancer, okay, the cancer for the
cancer.
teaching, okay, the cancer for the teaching will be the occult cancer. That is the most common. We are going to, why? Because the more use of the voice, okay, the cell are going to be mutating. So that is also one of the thing, as I told. But so in the as a point of view, the short answers are the short essays, okay. Short essays will may ask in the rarely, but the short answer they are going to be asked, okay. So some of the mention any 2 to 4 the occupational diseases, okay. So there you need to be mention the disease, and you try to write whatever the disease is there, okay. So here we are going to be expecting from the short answer.
People are working in the mining, okay. So occupational itself, the disease condition which is caused by our work, okay. So that is the thing we are going to study in this particular unit. If you are working in the mining
Mines.
and
Yes,
all,
not
or any
only
kind
mines,
of things, silicosis or
the mines will be there, the industries will be there, even for farmers, okay. You know the famous disease, that is farmer lung disease,
Yeah.
okay, due to hay dust will be there, cotton dust will be there. So as ma'am told, in the field of the industries, in the mines, okay, so we are going to having the silicosis will be there. That is one of the commonest the occupational diseases we are going to be having, okay. The pneumoconiosis, okay,
yeah.
yes, the diseases which they are going to be affecting especially the lungs. Why? Because the whatever the occupational disorders are will be there, they will be entered into airborne, okay. The small minute particles without we can see in the, even that may filter through our face masks also, okay. So such the condition that will be suffering, that pneumoconiosis we are going to be having. So such type of the occupational disease, and so we are going to be expecting for the short answers in this from the
sir
unit.
told using of face mask, okay.
Yes.
So by that, through that point we come to understand we have to know how to manage those things, because we can't able to leave work, right? We have to work. So for that reason that
They are the
management
basic
is
need, ma'am. The job is there.
yeah. So for that reason we have to know how to manage those things, okay. So that there also you have to work, and now we can go with the question
Some
paper
important
analysis.
Yes, ma'am. So this is
Who are writing for the first time, like fourth semester means you know already the adult health, for like adult health nursing first part you have written, right? So this is
So
the
here
second
we will
part
have
they
the-
are going to write, no?
Yes, ma'am,
second
second
semester
part.
you have written
So
the
already
first
you
part.
know about, I thought that you already know about your
Yeah. So yeah, you are going to study about the second adult health nursing second, and in that also same 75 marks questions we are going to be right.
Yes, you already in the whatever the how you have written with the adult health nursing 1, okay. The same pattern of the question paper is there, okay. The again 75 marks question, the 15 marks, the 2 questions will be there, okay, and the 5 marks, the 5 questions will be there, okay. The 2 marks, the 4 questions will be there, and 12 MCQs, okay. So this is the same pattern. So whatever you have been written for the adult health nursing 1, the same only we are going to be having here in the for the adult health nursing 2 also, okay. So now we will have the some of the very important, and the by analyzing the old papers, okay. Not only the semester wise, ma'am. So by analyzing the old year question papers also, so we have made the some of the important the questions for the 10 marks, 2 marks and the 5 marks. So as much as possible we are going to be discuss that questions, okay. And not only the you are not going to be pertaining to that question, apart from that, so as I told, the whatever the units are very important for the 10 marks, and whatever the units are very important for the 15 marks and the 5 marks and the 2 marks, okay. So you go through that all the whatever the subtopics will be there. So here some of the predicted question we are going to be discussing, okay. So apart from your job is to go for a whole syllabus. Why? Because so you need to be attend for the 12 MCQs, okay. So for the 12 MCQs, so for the which part of the pages of the syllabus we are not
Today
going to
also I have seen, sir, everyone written nice only the examination. When it comes to the MCQ, everybody were off. Okay,
Well,
they are sitting and thinking. We used to tell by the time of half an hour will be there remaining for the closing of the examination. By the time we are telling answer like that, but the students are thinking why it is happening. You should not know thoroughly the entire topic.
syllabus.
Okay, so each and every point also you have to be find it out and you have to write. So when it comes to this one, my hint is that when it comes to old paper, previous year question papers, okay. Yeah, sorry. What we will call for this PYQs, right? So when it comes to this one, you have to analyze like this. The first question which will be taken from which unit, okay? So while assessing this one, we come to understand that we have a question from the ENT. Okay, so already the deafness has been asked in the previous year. Okay, so same like that, there may be a chance to get the question from again from the ENT only, or either it may be ear or it may be nose or it may be throat. For sure, you have to study the high yielding part from this particular unit. Okay, you should not taking it as like from year only. This time also they will ask. Okay, it is not like that. Okay, the weightage of the unit is that the 15 marks long essay type of question we are expecting from this particular unit.
Yes.
Okay,
so in that for the first question, so as of last two examination we have seen from the ENT, as ma'am told already, the deafness has been asked, and for another one question paper the tonsillitis has been asked. Okay, so don't think that these questions are already asked. This time they are not going to ask. No, it is not like that. So when it comes to the other semester, okay, so for today's I think the foundation they have written the question which have been asked for the initial, again the same question only,
body temperature.
that has been, yes ma'am, the same has been came, okay, for the today's examination. So like that, don't skip. So whatever the question already asked, the first question for the 10 marks we are going to be from the ENT, as I told, from the ENT. Apart from that two condition, for this time, so they may ask about the otitis media. Okay, so I told in the initial of the first unit, otitis media, the mainly two types, that is acute otitis media and chronic suppurative otitis media. So that will be the two very important condition for the 15 marks, and including that one, the labyrinthitis, okay, and Meniere's disease. Meniere's disease. So that is also the very important from the ENT. And apart from that, already tonsillitis has been asked, although you need to study with including that one for the 15 marks. The expected question will be the laryngeal spasm. Okay, the laryngeal spasm is one of the what is that? The emergency situation. If the larynx is the main part for the respiration. So if it is becomes spasm, that is an emergency condition. So okay, that is also the expected question, including that one. Laryngitis is also one of the expected question from the unit. Okay, so the first question for last two exam we have taken from the ENT, and for the second question from the oncology. Yes,
yeah. Second question from the oncology, and one more thing, in the ENT they have asked regarding the deafness. Okay, already they have asked the deafness, but even though you should not neglect that particular thing. Okay, either they may ask for the 2 marks also, no defined deafness like that. So there is a chance, so no need to neglect any point. So you have to go through. The next we can go with the second question. Okay, second 15 mark question. It is all about, sir told that oncology. Okay, so in the oncology you already know. Okay,
for everything you need to study here. Okay, so why? Because from initial of the screening, that is the warning signs, from there to the particular cancer, okay, including hospices and the palliative care, the every topic will be the expected for the 15 marks. Okay, not only the treatment modalities will be there, or not only the cancer, so it may be the ask for the, and very important, the TNM classification. Okay, the warning signs will be the TNM classification, so that is also very important. Okay, for the second question, for the up to 2 examination, they has been asked for the oncology. Okay, this may also they are going to be asked from oncology, or so as we analyze the past year question paper, so I want to add the 2 more topics. Okay, so I want to add the 2 more topics for the long essays. So the one will be the neurological condition. Means this one, ma'am, for the year wise. Okay, so when it was in the medical surgical nursing. For their 10 marks, they are going to be asked from the neurological. But when it came for the scheme, the semester scheme, for the last 2 exam, they asked from these 2 only. But there will be a predicted chances. Okay, the 10 marks may came from the neurological 1 unit, and apart from this one, the burns. Okay, so for the long essays, so we are going to be having the units like the ENTs, oncology, the neurological and the burns. Okay, so from these 4 topics are the very important for not only in the long essay, for the even short essay, the short answer, and for even MCQs also. Okay, for even MCQs also, this is the 4 units will be very important. And up to that, again we are going to tell these 2 has been taken for long essay. These two
you have to be
preparedness.
For your preparation, for your sake of examination, and for your safety, you have to get ready for this also. Why? Because now, once you remember, sir, when while writing the examination, without expecting, plastic surgery came.
Yes, ma'am.
Yeah. By the time plastic surgery was,
it's
bit
like
of students are neglected. Nobody will ask for the 10 marks.
Plastic surgery is like, as we are nurses, we are not having that much of the role in the plastic surgery. So as a post-operative care, we are going to see that. So if any infection is going to be occur in the implanted site will be there. But for the annual examination, he has asked about, for the 10 marks only, explained about the plastic surgeries. Okay, the cosmetic surgeries and the plastic surgery they has been asked. So that's the reason. Don't take the risk. Okay, for these 2 units also, we may expect it for the long essays. Okay, including these 2 in the neurological and the burns, and the neurological condition, what the important topic we have already discussed. Okay, and in the burns, the fluid calculation by using the Parkland formula will be there, and the assessment of the burn by rule of 9. Okay, so that is
very important.
Very important.
Very important. Must and should study. If they are not asking also, it is very important in sake of your practice, clinical practice. Okay.
So this is about the
15 marks. Okay. So the 15 marks has been cleared with these 4 units. Okay. The next thing we have to go with the short essay. So the analysis of the short essay is that the very firstly they have asked regarding explain the assessment of the eye. Okay, which means ophthalmology they have asked. Okay,
related to the eye.
Eye, which is the disease condition which is related to the eye. From that particular unit, we may expect the 5 marks question. Okay, either it may be cataract, glaucoma, management, everything they can ask from the ophthalmology.
Yes.
Okay.
So from the eye, we are going to has in the initially I told in the starting of the class. So from here, has ma'am told, the retinal detachment, the glaucoma, and the cataract, including the blindness. Okay, so the program of the blindness, the national one of the national program is there for the prevention of the blindness and including the eye banking. Okay, so that is has we already told that when the question paper setter has sit, so he is going to look for the trending wise. Okay, so as of that one, so we may expect that the related to the blindness and the eye banking program also it will be there. Okay, so you need to be study for that one also. And so the from the eye we are going to be expecting for the short essays. Okay, and the topics already have been discussed initially. So apart from this one, the short essays, so we are going to be
there may be a prediction they may ask regarding the cataract and as well as the blindness. Okay, or everything is a eye yielding topic in the ophthalmology.
Yes,
but even though blindness will be hit in a different way, so maybe they can ask. The next thing is we are going with the renal.
Yes, ma'am. Again the next unit it will be the renal. Okay. So
renal diseases. Okay, so under that they have asked nephrotic syndrome in the last previous year question paper.
So apart from that one, as we already see, there are the very important topics like the infective condition, that pyelonephritis will be there. Okay, glomerulonephritis will be there, the infective condition for the 5 marks, and apart from that one, so we have seen that is a renal calculi.
This is very important.
Yes,
renal calculi.
The renal calculi are the what we are going to call as the kidney stones. Okay, in general we are going to call it as the kidney stones. Okay, so the renal calculi and the kidney stones are the very important, and with related to that one, the renal failure. Okay, the renal failure. So the nephrotic syndrome has been already asked, although you need to be study with that one, including that one, again for the 5 marks, the important will be like the renal calculi. Okay, so how they are going to be asked the examination, the mention the types of the different types of the renal calculi and the management of the renal calculi, or they may ask about the explain the role of the nurse in the surgical intervention of the renal calculi. Okay, if they ask like that, so there you need to write what is the definition of the renal calculi. There you are not going to supposed to write the types, they asked about nursing management. Okay, so directly you need to mention the 1 to 2 3 medical intervention, and the next you directly go for the surgical. Okay, lithotripsy already you know, so what is the role, the pre-operative role will be there, post-operative role will be there, and related to some of the nursing diagnosis, and if possible you can put the nursing care plan also, that will be also very high yielding for your examination. Okay, so that will be there, and the renal failure, so that will be acute will be there, or the chronic renal failure will be there. Okay, so that will also we are going to be expecting for the 5 marks from the renal system.
Particularly they are asking about the management only. Okay, so by seeing itself we come to understand, no sir, this particular disease condition having the surgical intervention.
Yes,
okay, so by that time we have to include all 3 phases of the intraoperative. While discussing this what we are going to study up next means we are going to know about how to write the AHN. That is very important, right? Because few people are not knowing, the students will lose the marks. Okay, simply they are writing like a story, so we will discuss that later. And next we can move with the next question, 5 question we can expect from that emergency.
Yes,
okay,
like disaster.
Sorry sir, in the emergency we are going to emergency ward, they have mentioned burns. Okay, so 5th question is all about burns, don't be confused. We are going to expect the question from the burns 5th unit. Okay, if they are not asking in the long essay, there is a less chance to ask in the long essay, but even
as for the semester scheme,
as for the semester scheme, if they are asking there, they will not ask here. If they are not asking there, for sure you will get the
100% they will get the question from the
burns
for the short essay. Okay, so in the burns already we have told in the 10 marks 15 marks only, the again same fluid calculation will be there, skin grafting will be there, as ma'am told plastic surgeries. Okay, the suddenly they have given in the examination, the plastic surgery will be there, cosmetic surgery will be there, so that and all we are going to be expecting from the burns. Okay,
rule 9 they may ask.
Yes ma'am, explain about rule 9. So you need to draw the diagram. Okay, so you already know about the diagram, and whichever the body parts having how much the percentage and all. Okay, so you write just mention, and you need to write the percentage and explain one by one. Okay, so that will be the role of the 9 they are going to be expect to be asked, ma'am. So apart from this one, so we may expect from
the next thing which we are going to expect from the neurological disorders.
So I told here only I will write the burns at so as I told this burns
6. The 6th question. Okay, in the 6th question sector we may expect from the neurology.
3, this is 4, this is 5. Okay,
yeah,
for the 6th. Okay, so as we told the burns and the neurological, if they may ask for the 15 marks, here they might ask or no, but if they did not ask in the 10 marks, okay, for the 15 marks for sure here they are going to be asked. Okay, so in the neurological you are having the different condition as we already discussed. Okay, so that is for the neurological.
So the neurological disorders we have already discussed each and everything. Next 7th question, it's all about the immunology.
Yes, from the immunology, so we may are going to be expecting to get the question for the 5 marks. Okay, so as already we have discussed for the short essays, so the immunology is also one of the important, has it will relate to some of the autoimmune diseases will be there, and some of the immunological disease like HIV and the AIDS will be there, and related to the national program. Okay, that NACO program will be there.
Already national AIDS program they have asked in the previous year. So yeah, apart from although it is important, apart from that you may concentrate on more on the other things which will be present in the particular unit. Is there anything in the 7th?
No.
Okay,
no.
You write just immunology. So the seventh question which we can expect from the immunology, it is one of the eye yielding. So definitely you will get the question from that for a short essay. Next we can move with a short answer. I don't want to waste your time.
So before going to that one, so apart from this, we may expect the short essay from the care of the elderly also.
Occupational.
From the care of the elderly, and the occupational also it will be there, but for the occupational the short answers will be the more as compared to the short essays. The care of the elderly, so we are going to be having for your examination, and apart from, so even in some time they may ask from the oncology. Okay, so oncology they already given 15 marks weightage also, so for the some time they may ask. Okay, so don't forget to be study even oncology also. Okay, so this is about the short essays. So whatever the topics, whatever the units that may come for the short essays, and not only short essays, they from for the short answers also we are going to be expecting from these units.
So we have discussed from where we can expect how many marks type of questions. Each and every sector has been cleared over here, and we have discussed the important high yielding topic also. According to those topics you move on, definitely you will pass, and we can't predict that MCQs, right?
MCQs, yes,
before going to tell the answer presentation, we are most focusing on the short answer. Either you can get from all the units,
yes,
there
yes,
may be a chance, okay, like Mania's disease,
yes,
deafness, blindness,
the definitions,
definitions types.
Okay.
So most probably they are going to be asked that only, or else they may ask a simple management techniques also.
Yes,
they may ask, okay, and warning signs of cancer.
Yes.
Okay,
The
like
clinical
this
features will be there, types will be there. Just they are going to mention the types. Okay, as I told, they mention that the types of the renal calculi. Okay, so the calcium stones will be there, steroid stones will be there. So like that, the types they are going to be asked for the 2 marks, and in that 2 marks also, the mainly, as you are having only 4 questions, right, ma'am? For 4 questions, the most, if we are going to be predicting the one question from male reproductive system. Okay, why? Because so since we have seen from the 15 marks and the 5 marks, we have did not see the male reproductive system, right? So that male reproductive system is a very important for the 2 marks. Okay, so yes, 2 marks that will be, and critical care. Okay, the critical care will be the important for the 2 marks, and apart from that one, sometimes from the immunology. So from the immunology also they are going to be asked for the 2 marks, and apart from this one, the another one question will be from the any other units. Okay, so for the immunology and the reproductive system, the 2 marks or the 2 question will be fixed for every unit. One question.
One more
will
unit
be,
is there, no? This one, sir, elderly.
Ma'am, elderly, care of the elderly, they may ask for the 5 marks. Okay, they like explain about the abuses and all, but if they did not ask in the 5 marks, so it will be again for the short essay. Okay, the short answer, for the short answer, so we are having the male reproductive system, okay, and the care of elderly, and the next, so critical care,
occupational disorders.
yes, the occupational disorders. Okay, the occupational disorders. So from these 4 we may expect the 4 questions. Okay, so apart from this one also we may expect from the anywhere for the short answers. And for MCQ, as ma'am told, so we can't predict it. So from anywhere from the syllabus copy, so the MCQ is going to be asked. Okay, so for sure that for the MCQ you need to be read thoroughly. Okay,
and moreover, one hint I would like to tell, practice. Okay, practice 100 or 50 MCQs from each and every unit. That will for sure everybody will do the same thing. Okay, even though if you people are studying for the competitive also, they used to do the same thing, right?
Yes,
they used to do the practice of the MCQs from the previous year question paper. Same like that, you can go with the internet, or you can go with our Instagram page also. We have mentioned lots of MCQs, and our app also it will be there, and we have discussed in our YouTube video videos also will be available. You can go with that. Not only that one, you can download from the Google also. You can practice. Okay, so that will be boost up your knowledge for your like tomorrow's sessions. Why? Because I have seen the students like they are stopping up in the MCQ. Because before that from 15 marks they will be rushed like anything, and 5 marks also they are writing like anything, and after that they are writing short answer also. Everything is possible with them, but MCQ it will be acts as a tricky questions.
Think that the question paper for the MCQ, whichever when we are going to read, suddenly the answer will be not get, and if suppose the suddenly answer we get, that answer will be wrong. That is the one trick we need to be used in the MCQs. That so if you are reading MCQs, whenever you are reading, if you suddenly got one answer, so that may be wrong. So for the correct response of the MCQ, so you need to be study each and every topic. Okay, so in detail the each and every topic you need to be study to get the marks in the MCQs. Okay.
So this one is the answer writing tips. Okay, why? Because I am telling sir, so you know, right, we are studying various subjects. Okay, from year to year, semester to semester, the subject has been changed. Okay, each subject demanding a certain demands of the answer in their own particular way. Okay, when it comes to our subject, that is what adult health nursing or the medical surgical nursing, there is a certain way how to write. Okay, so I will write. So we know that we have a 5 pages, right? Right, no sir?
Yes, yes.
So we have a 5 pages. So what you are writing in this particular 5 pages, especially everybody will feel that there is a shortage of page for med surg.
And even shortage of time also they told, but I thought that the time will be sufficient. Okay, it's okay, ma'am.
So we will go with the first thing is that introduction. A small and tiny introduction is needed. So it should not be like 1 page or 2 page. It should be like we will wind up within a 2-3 points is enough. Okay, so because the evaluator has to know that the person has been understood this topic very well. Okay, so for that reason, if you are not writing also, then there is nothing to affect. After that, we will go with the definition in the first page. How we need to write the definition? Suppose we are taking one particular disease condition. You may think that we are writing the particular disease conditions definition according to the particular author. Okay, suppose I am writing here one definition. Here you can write according to whom and when it will be. Okay, while studying only you have to study this one. This will for sure you will get the good marks. Okay, that only they are going to assess in the evaluation.
And, for especially for the adult health nursing, so the some of the definitions will not according to the author, means according to the some persons. So when it comes to the psychology or the sociology, there we are going to having the some of the famous things. But when it comes to adult health nursing, so the definition is according to the publishers. Okay, so if it was who is the author of that one, so according to that publications or according to the name of that book author, so we are going to be taking. Okay,
yeah, sir, I Clement sir, if you are referring, definitely I Clement sir name you write. Okay, so that is the way you have to represent the definition part. Okay, next after that we are going to the, suppose they are asking about the disease condition. So particular disease condition we are going with the etiology. Okay, etiology means what? We are going with the causes. Okay, so after this causes, if you are writing, see, don't write in such a way that 1, 2 or like one line only all the causes, 5, 6 causes. You should not write like that. Point it out each and every causes. Okay, so you understand how much page you want. Okay, suppose we have like this kind of page, one page will be there over here. You have to know, right, where you have to write, what you have to write, how much you can able to write. That matters a lot, right? So that is how you have to plan beforely while like you are writing the answer. Okay, that is what you have to focus more. And after that, after the etiology, if they are, see, adult health nursing with the integrated pathophysiology, so you have to be focused on the pathophysiology a lot. Why? Because I'm telling you have to know thoroughly about the disease condition process. The pathophysiology is the entire thing which we are going to study. Okay, so that you have to write the pathophysiology if they are asking. If they are not asking but they are giving a disease condition, kindly go. Nothing will affect. Okay,
if they ask about the particularly pathophysiology, So you need to first try to put the flow chart. Okay.
Yeah.
So
it will
with
be
that,
in this, such a way only.
such by arrow marks only it will be there. Okay. So if they are asked particularly for a pathology, first you try to write in the flow chart and you again go for the explanation. Okay. For the third page again you go for the explanation. If they ask particularly explain about pathophysiology, if they did not ask, just you write the flow chart.
Flow chart, okay. You should not write in paragraph or the story like content. You should write in this like representing in this way, and it will be definitely looking also good, and while understanding also it will be very nice. Okay, you will get the good marks. After the pathophysiology, we will go with the clinical manifestations. Okay, so the clinical manifestation, either you may adjust here also etiology, like after the etiology you can write the clinical manifestations also, but if you want to write after that means you can go with this. Okay, if they are asking explain the clinical manifestations, if they are not asking just list it down and move on. Okay, after this clinical manifestation you have to go with the diagnostic evaluation. This is very important to know that how we have to write. First we will go with the history collection, physical examination, blood culture, blood test will be there, urine culture, and according to the particular topic we have to do certain. Yesterday we have explained, right, if it is come to the digestive system we will go with the ultrasound. So that is how we have to go with that. So hope you guys are understanding. If you are not understanding, please do comment. And
one thing that for most of the condition or most of the time the diagnostic evaluation explanation no one will ask. Okay, so just you need to be mentioned. So what are the diagnostic evaluations we are going to be done? So for the particular disease, that disease will be depend upon diagnostic evaluation, then only they will ask. Otherwise just you make the list of the diagnostic evaluation and you will move on to the next
yeah. So next, after finishing of this, the next part, important part will be management. Okay, so this is the very important part. You have to know how to write this one. First we will go with the medical management, and in that we are going with the pharmacological management or the pharmacological therapy we used to tell. Okay, so the treatment what you are going to supposed to give. Okay, so you have to write the medication's name along with that drugs. Okay.
At least two medication you need to be write the that name of the classification or the name of the
group of drugs.
So you at least mention 1 to 2 drugs name. Okay. So if it is like antihypertensive drugs, there we are going to having the CCBs. Okay, so for the CCBs, whatever the drugs we are going to be using, like atenolol and the metoprolol, like that you need to be mention the 2 drugs. Okay,
if the condition demands the diuretics, you can write the furosemide, loop diuretics, like that you write, and I give one example. Okay, so pharmacological management will be over. Next, so you are now also in the 4th page only. Okay, not in 4th page, either it may be you have to finish off in the 3rd page it seems. So the next thing after pharmacological management, we will definitely go with the surgical management. Okay, so don't write the surgical management in a story. Okay, you can remember this in a very easy way and minimalistic way that I will teach you now. So we will go with the surgical management deeply if they are asking the surgical intervention. Okay, so what you have to do in particular condition, see, suppose they are asking about the breast cancer and the mastectomy. Suppose we are taking that condition, you have to write the pre, post and intraoperative. Okay, so you can write according to pre, intra and post also you can write. Okay, when it comes to the pre, we have to do the physical preparation, then physiological preparation. Already you have studied, no? So all these things you may have mentioned here also. Okay, so the page will be also there, and you have to write with the psychological preparation and pathological, which comes to like diagnostic evaluation. The reports have to be handled in the pathologic. Okay, no need to explain all the things, but you have to mention over there when it comes to the surgical management. Okay, post means we are going to intra means we are going to provide a care according to the condition. We are assessing the vitals. This is the thing which will be there and administering the medication as per the surgeon. The next thing, post operative, we are going to, when the patient will be shifted from the operation room to the recovery room. By the time the post operative period will be start, by the time we are going to assess the airway, breathing. Okay, we will call it as the nursing alphabets A, B, C, D. Okay, so same like that. In this way you remember means you can easily elaborate your answer when it comes to the surgical management. Okay, if they are stressing the surgical management by the time. So elimination pattern, follow up and health education is the very important. So this is how you have to mention after finishing off this one.
So before that, if they asked the particularly for surgical management, you write all these, okay. If they did not ask that, just write the management, you just mention the names.
Yeah.
Okay, so as ma'am told, for the breast cancer, mastectomy, the removal of the breast.
Okay.
That's it.
So
okay.
that's it enough. And next we are going with the nursing management. You already know how to write the nursing management. There is nothing to explain here. Okay, how you are going to provide the care. Okay, provide a proper care, proper comfort, calm and cool environment for the patient, for the rest and sleep. All those things, whatever according to the condition, you can move with that. After that nursing management, what we are writing, we have to go with the nursing diagnosis,
yes.
right? So we are going with the nursing diagnosis. So there you write must and should five diagnoses. Okay, 1 2 3 4 5 diagnosis is very important. You have to write according to the disease condition 5 must and should diagnosis. Then we can go with the 2 or 1 must and should care plan for the adult health nursing.
Yes.
Okay, so you have to budget your paper. 5 paper, it is not possible. First front 2 pages only, fold it and write. That is the trick you have to use. And next thing, if you want to write, if you have really the page means, go with the health education also, no issues. Okay, so that is very important. You can write
for the
it.
disease condition, as ma'am told, up to this, literally the 5 pages is not available. If available, you can write health education.
Yeah, if you get the space, definitely go with that. Even we are writing, by the time I written, somehow I adjusted. You also use
Has
your
told,
brain.
no, ma'am told the first phase, okay. So has actually that is the best first phase when you are going to write. So introduction, some 3 to 4 lines you are going to write, okay. So try to write the definition here only, okay. If there is a presence of types, so you also need to finish it off in the first page, okay. For the second page, as ma'am told, you just bifurcate, okay. So you make the 2 portion. So one portion you write the etiology, okay. For the another one portion, if there is some condition like hypertension, okay, and DM, so there we are not having to have etiology, there we are having risk factors, okay. For such condition, so you write the etiology in one side and risk factor in the one side, and if possible the types also you can write one by one, okay. So by making this like this, you may arrange the pages as ma'am told, okay. So that will be depend upon the condition which they have been asked, okay. So if they asked about whole disease, okay, so whatever the thing the ma'am had told for the 5 pages, if they ask for the particular for the whole disease, okay, in the some condition what they will ask only about pathophysiology, okay. If they ask about pathophysiology, as I told in the first page, introduction, definition and the etiology, okay. For the second page, the whole page you put the flow chart, and the third page you explain that pathophysiology.
I think, sir, for semester batch there is no consolidation for the pages. They may strike it out and written. Why? Because today's session I have observed Nursing Foundation, they have struck it out the question number and
it's
they have
again depend upon the booklet which has been provided to students.
Yeah.
Why? Because so we are having 2 types of the booklet which is having 150 pages and we are having 125 pages. That 25 pages will not have the number as you told, ma'am. So that will be used for the 2 QP codes in a single examination like nutrition and the biochemistry. Okay. For 75 the examination depend upon the booklet.
Yeah,
which
definitely for sure you will get the question paper, but as my observation, students have struck it out the question paper and writing. Yeah, 15 marks means the pages should be more.
Yes,
Yeah, according to invigilators advice, suggestion, you just go.
I think university will follow up in the next session. Yes. Why? Because as before 10 marks is there for the year wise, that 5 pages will be enough. But nowadays it is a 15.
Also we are struggling, sir, to adjust.
So you are okay. So presently it is a 15 marks question. Okay. So for the 15 marks, already the so many recommendations are there. Let we need to see in the further the RGVSH patient.
Applications,
Okay.
yeah.
So this is all
So
about
this is
today's-
all about the today's session, and hope you guys are understood very well and got the important topics also, how to write. This is the major things which we have to focus, and everything was done. So all the best for your examination. See you in the next sessions,
Okay,
upcoming
so
examinations.
Once again, all the best for your tomorrow's examination, and prepare well for the your examination. Okay.
Thank you.
So we will end up. Thank you.
Endayo.